Hi and welcome. Welcome to our free video series, Integrative Female Athlete Wellness. 9 lessons for building a female athlete practice that serves girl and women athletes of all ages and all levels. Hi, I'm Jessica Drummond. I'm the founder and CEO of the Integrative Women's Health Institute, and I am thrilled to present to you today the 9 lessons that I think are essential to running a very holistic women's health practice, which focuses on female athletes. And your entire practice does not have to focus on female athletes for this to apply to you. It may be just a small piece of your practice or a practice that you really want to grow, or maybe you actually are working with female athletes right now and you don't even consider them female athletes. They're the new moms who are trying to run a 5K. They're, tween ballerinas who are just starting to go through puberty. So they don't have to be Olympic level athletes for your patients and clients to fit into what I consider female athletes, because I think every girl and every woman who is out there participating in fitness classes, in sports, just keeping herself really active through the lifespan, has many of the same physical and spiritual and mind-body issues that even our elite Olympic athletes deal with. And of course, if that's a population that you're working with, great. NCAA college athletes, great. Everything will apply. All right, so let's just jump right in. What are the 9 lessons that I believe that every women's health professional who works with this population really needs to understand to fully and holistically serve the girls and the women, athletes and future athletes in your community, in your practice? The first is they need to have some fundamentals. You need to have some fundamental understanding of how structure and function are related in this population. Girls and women are participating in activities that, do come with some risk. Think of girl gymnasts. Think of, new mom CrossFitters lifting fairly heavy weights. What is their physical alignment? Are they aware of it? Are they aware of how it should shift when they are changing their activities? Or are they aware of starting to exercise in a certain way physically after having sat at a desk for 8 hours a day for years at a time? So we're going to kick off the program talking about the idea of alignment, of physical structure, and bending without breaking. And this applies across the board. If you're a fitness professional, you see and work with this every day. If you're a physical therapist, you see and work with this every day. But even the things these lessons that you think may not apply to you. Let's say you're a nutritionist and you're not really thinking about structure of the clients, but you need to be thinking of that if you're going to be treating and taking care of your clients holistically, because each of these lessons has an important piece in your client's overall health. So hang on to that thought. And anytime I come across something and you think, oh, I don't think this applies to me, that's not the kind of work I do, I still want you to have a strong awareness of it, for you to be giving your clients their absolute best care from a really holistic perspective. Because even if it's not the specific skill or tool that you might use in your practice, it's not maybe in your scope of practice, and that's fine. You need to know who does take care of these things so that you can start building networks and teams to collaborate with when working with your unique clients. All right, so lesson 1, bend without breaking, structural alignment. Lesson 2, don't forget the pelvic floor. So we think of alignment, we think of the whole body, and often there's this kind of invisible black box around the pelvis. We don't like to think about that area of the body. We don't like to go there unless that's our specialty. But really, every sports coach, every health coach, every fitness professional, every nutritionist, every orthopedic physical therapist and neurologic physical therapist needs to understand pelvic health and how it may be impacting their female athlete clients, your female athlete clients, because again, these are issues that these women clients may not talk about with anyone else. And you need to keep an awareness about them so you know the resources. Third, nutrition for young female athletes. So here are girls in their teens and tweens who are going through puberty, who have a lot of brain development going on, who are exercising quite intensely in some cases. How are we supporting their growth when we're giving them pizza and Oreos after every, soccer game, right? We have to think about how we can, again, across disciplines, as parents, really fill in the nutritional gaps that these young athletes need. All right, now, lesson number 4. Nutrition is not just something we have to talk about for our youngest female athletes, but nutrition, especially when thought about in context of a woman's entire menstrual cycle, can lead to giving her a performance advantage. So anywhere from puberty all the way until menopause, women have this unique opportunity. We are menstruating with essentially the moon cycle, ideally every 28 days. Now, I know this may take some work to get there. Some of your clients may have been on birth control pills for a long time and their menstrual cycle may have been suppressed. Other clients may have irregular cycles, may have problems with their cycles because of things like PCOS or other issues that can impact the health and regularity, and they may have symptoms with their menstrual cycles, for example, in the case of something like endometriosis. So in this program, we're going to be talking about how a woman's need for different kinds of foods actually changes through the menstrual cycle. A woman's need for different kinds of support, for different athletic goals also changes through the menstrual cycle. And when you can really tap into this, it can give you a distinct performance advantage for yourself and for your clients that probably no one else has ever discussed with them. Then we're going to have 2 modules, one major lesson on the female athlete triad. This is a very important issue. It's common, it's dangerous, and it's something that anyone who's working with a female athlete population, nutritionist, physical therapist, fitness professional, coach, every single person interacting with young athletes needs to understand female athlete triad because it is so important to protecting a young woman's health. Eating disorder, menstrual irregularities, bone health problems can start very young and have dangerous effects and dangerous long-term effects on her cardiovascular health is one area. Her bone health is another key. All right, our 6th lesson, we need to be looking at alternatives to some of the common medical tools that we've had in the past for dealing with common issues that pop up for our female athlete clients, right? Anyone who's going to be exercising intensely, training for a sport is going to have some, joint issues, some muscle strain, some muscle pain. From time to time over the course of a career, expecting these things is very normal. But if we treat it with non-steroidal anti-inflammatories, things like Advil or Motrin, we are actually putting our athletic clients at risk. And we need to be offering them some alternatives and looking at some proven evidence-based options in the herbal medicine realm for supporting common athletic injuries and for reducing the pain and inflammation without the very risky side effects of heart disease, digestive problems, and even infertility that our clients don't want. Our next lesson is food as medicine. So herbalism is one way to address some of these chronic pain, chronic inflammation issues, or even acute pain, acute inflammation issues that can pop up in female athletes. And food is very preventative of chronic inflammation, chronic pain, and it can be used as a medicinal treatment in a way that's extremely powerful. So nutrition can actually be used for prevention and recovery from injury. Again, even if you are not a nutritionist, if you're a health coach, if you're a physical therapist, if you're a fitness professional, you need to understand the evidence-based nutrition for this population because it's so important. 8th lesson, mindset. So I think sometimes we underestimate the importance of taking care of the body. And in female athletes, a lot of your clients are going to be very into their body, very connected to their body. And we do need to treat at the body level. We do need to support at the body level. But without appropriate mindset, if our clients are working really diligently, they're training, they're eating correctly, they're not getting injured, but they have, the mindset of overdoing it, pushing to fatigue, pushing through fatigue. They're not thinking of their athletic careers over the course of a lifespan, but just thinking about how they're doing at this performance. And if it was terrible, then just getting stuck there. There's so much that what they are telling themselves about each and every practice, each and every injury really impacts both their performance and their risk for injury and their recovery from injury and their ability to sustain being active from childhood all the way through being an elderly woman. And that is really my goal, is to help support women to feel healthy, to exercise, to stay active through the entire lifespan. And our final lesson for this video series is business building strategies. You've got to expand your reach and start working with these women in your community. They are searching for you. They already want nutrition information. They already want mindset information. They already want structural alignment information. They want someone to look at them as a whole woman in the context of her sport, not just to look at her as a, how fast is she in soccer, or did she make the team? And these women are excited to understand what you have to share with them. And here's the thing. You can go to a million continuing education classes like this one, be super knowledgeable about how to take great care of female athletes in your community. And if you're not doing the work from a business perspective, you're not getting them through your doors, you're wasting that wisdom that so many women right around you on your online community and your local community are just hungry for. So I'm going to give you some tips for how to bring them through the doors so you can actually serve them. So let me introduce myself a little further for those of you who don't know me. My name is Jessica Drummond, and you actually are going to get 3 teachers on this course, Female Athlete Wellness. I am going to be narrating this video series, but in a moment, I'll introduce you to the other 2 teachers who are actually on the Female Athlete Wellness course, which I'll tell you about a little bit later. So again, my name is Jessica Drummond. I'm the founder and CEO of the Integrative Women's Health Institute. I've been a practicing women's health physical therapist and orthopedic physical therapist since 1999. And about 5 or 6 years ago, I stopped hands-on practicing physical therapy and shifted. I became certified as a health coach through the Institute for Integrative Nutrition and Duke Integrative Medicine. And I became certified as a clinical nutritionist, and I'm currently in a doctoral program studying functional nutrition. I have been active, so even though I don't work hands-on with women anymore, I have an active women's health coaching and nutrition practice that is busy and full and bursting at the seams and has been since about 2009, which is great. And I'm active in that clinical practice. I think all teachers should really be active in clinical practice to stay on the cutting edge. I lecture internationally on functional nutrition topics in women's health, and it's my absolute pleasure to do so. We have students from about 25 different countries now in our online education programs, and I do lecture live at several conferences per year. Now I want to introduce you to Dr. Julie Granger. She's a doctor of physical therapy. She's a sports medicine clinical specialist. She's a youth sports specialist physical therapist. She focuses mostly on children, teens, and very young adults. And not only is she a clinician working with girls and young women athletes, but she has been there herself. She was a Division I swimmer at Duke University for 4 years, and that is a tough thing to do, be a varsity athlete at such an intense school. So Julie Granger not only teaches this, not only works with patients, but she has walked the walk herself in so many different ways. She lectures nationally. In fact, the largest meeting of physical therapists in the United States last year, she was invited to give 2 talks, which is excellent, virtually unheard of. She guest lectures at Emory University and Mercer University. And again, she's active in clinical practice, working hands-on as a physical therapist. And I'm thrilled to introduce you to Michelle Lyons. She's a physical therapist, herbalist, yoga, and Pilates instructor. She's a women's health and orthopedic physical therapist. She is a globe trotter. Really, I think right now she's teaching in Ireland. She probably just got back from Australia. Earlier this year, she was in Minnesota. She teaches in the Middle East, in Turkey, all over Europe. She literally in the last year has been on practically every continent teaching. She is in extreme demand. She is a clinical lecturer on pelvic health, herbal medicine, bone health, and female oncology. She has an active coaching practice out of her home in Ireland now. And she has worked actively in physical therapy practice in the US and in Europe. So I am just honored to bring you these amazing teachers. Now, you are in the right place. If you are a physical therapist or a physiotherapist of any kind, you don't have to specialize in women's health. I think those of you working in orthopedics, neurology, pediatrics, geriatrics, this is information that women throughout the lifespan need, even if they are coming to you for a knee injury or a different kind of sports injury that has nothing to do with quote unquote women's health, hormones, and menstrual cycles. It's all related. We can't just chop women up into different body parts. If you're a fitness professional, personal trainer, yoga instructor, Pilates teacher, same thing. You are in the right place. If you're a sports coach, I'm so glad that you're here. The girls on your teams and the young women on your teams really need to hear how to take care of their bodies in a very holistic way so that they can preserve the ability to exercise well into older age. I personally was a gymnast from age literally about 3. I started competing when I was 7, all the way until I was 17. And I used to practice, certainly in middle school and high school, in the neighborhood of about 20 hours per week. Talk about burnout, right? And most of the time I loved it, but there were times I got sick. No one gave me any kind of connection to my female menstrual cycle, how that could affect my performance, how it could optimize my performance if I really understood it better, And then as I've grown older, I don't like to think of it as aging. As I've grown older, I love to still exercise and move my body. It's in a very different way now, but I wouldn't have the capacity to do so. Many of my friends have been quite injured, live quite sedentary lives now, and that has such a negative, dramatic effect on their overall health that I think it's really important that we think of girls and women as having a healthy lifestyle that sports can absolutely contribute to if we take the long view, the holistic view, and not just, get them ready for next week's competition and do their best and, making the team and winning the meet. It's not the same thing as taking care of the girl in a holistic way. And sometimes it is a piece of that. Girls gain a lot of empowerment from winning the meet and, making the team. But if we don't think of it in context, that this is a girl, it's one event as part of her athletic exercise career and not her entire life, then we are really missing the boat for her in terms of giving her health through the lifespan. So sports coaches, health coaches absolutely need to be here. Nutrition professionals absolutely need to be here. Nurses, nurse midwives, obstetrician gynecologist, sports psychologists. I'm so glad you're here and I welcome you. Anyone who loves working with women and girls who are active, who wish to be more active. If you love working with women and girls in sports to support them to have fun, avoid injury, reach their performance goals, and recover more quickly and easily from injury, you are in the right place. And if you see a big need in your community to better serve active women and girls, and you want to be the person to step in and fill in that gap, you are in the right place. So again, let's review. The focus of this video series is the 9 lessons that I believe every women's health professional who works with female athlete clients needs to be thinking about every time an athlete is in front of them. Supporting her to bend without breaking, teaching her pelvic floor health, filling in the gaps in nutrition, especially for our youngest athletes, nutrition through the lifespan and through the cycle, and using it for performance enhancement. We'll talk a lot about that in video 2. The female athlete triad, using herbs and food as medicine for active girls and women, a mindset of a longevity and holism in sports. It's not about just the next performance. That's only a piece of the puzzle. Practice building. You cannot serve anyone, no matter how smart and how much you know about this topic, if you don't bring them into your world, into your practice, into your fitness classes. So we can't teach everything in the time that we have together. I can't teach you everything. So I'm going to focus in this video series on a few of the very essential keys, and you can start implementing these keys in your practice right now. So in this first video, we're going to be talking about why every professional working with women needs to understand pelvic floor health. In our next video, video 2, take a little bit deeper dive into nutrition, what's missing in nutrition for youth athletes, and how integrating nutrition recommendations with the menstrual cycle can actually be performance enhancing. I can't say this enough because it's such an exciting idea to me. Video number 3, more and more data is coming out about how NSAIDs are risky and how many, women runners, women triathletes, women CrossFitters, even young athletes, youth soccer players, high school varsity cheerleaders are taking Advil several times a month, if not even every day, every week. This is having huge impacts on their cardiovascular disease risk, their digestive health, and even suppressing their fertility. And some of this stuff we've known since the mid to late 90s, and it just has not been discussed. So herbal medicine and food as medicine are important tools for the common and normal inflammation and pain that can come along with being an athlete. And video number 4, we're going to talk about some practice building strategies and how to go even deeper in this material with Dr. Julie Granger, Michelle Lyons, and myself. Let's jump right in. So, okay, you're thinking to yourself, look, I'm a coach, I'm a nutritionist, I'm an orthopedic physical therapist, and I'm an occupational therapist, whatever. Why do I need to know anything about the pelvic floor? Aren't there women's health, pelvic health, physical therapists, physiotherapists for that? Isn't that what our gynecologists and urogynecologists are about? I don't really want to talk about that area, Here's the thing. Every single one of your women clients has a pelvic floor, has a bladder, has a vulva, has a vagina. And we can't just cut that piece out of a woman. It's a part of her anatomy, it's part of her physiology, and it impacts her athletic performance. So if you are going to truly be taking a holistic, integrative approach in your practice, that means you're taking care, holistic, of the whole woman. Her mind, her spirit, but also her body. And we don't want to chop any parts of that body off And we can do that kind of energetically if we're just ignoring them. It doesn't mean that you have to treat pelvic floor issues. You don't have to specialize in this. You don't have to talk about it all day long. You don't have to learn pelvic exam techniques. It just means that you need to integrate the pelvis within the body of the women that you're serving. And you need to know the risks to your clients and know their resources so you can refer them to women, to other clinicians if they have some of these pelvic health risks. Because here's the thing, incontinence, prolapse, pelvic pain, these are barriers to participation in sports and fitness programs, and not just in women who've just had a baby and are, leaking when they're sneezing, right? Leaking when they're jump roping, leaking when they're running. That's not normal, and we have to take care of that. But it's even happening in our teen and tween girls, and we need to, the earlier that we address it, the better, because if we wait, really the number one cause of death in elderly women over a certain age is hip fracture. And oftentimes those occur because women are rushing to the bathroom. So if we can teach women and girls the earlier the better, about their pelvic health, how to keep from leaking, how to keep strong, relaxed, flexible, functional pelvic floor muscles, we can actually impact her health all the way through into her older years. So 80% of young women athletes who have not had children do struggle with stress urinary incontinence in certain sports, in those sports where jumping and impact are common. Sports where incontinence is common, even in young girls and women before giving birth, and after giving birth, these numbers get much worse. Gymnastics, cross country, track and field, basketball, tennis, volleyball, ballet, and Pilates. There have even been some studies on Pilates teachers showing how often they're leaking. So if this applies to you as a coach, as a clinician, I always like to integrate my learning by starting taking care of myself. And we teach that to all of our students at the Integrative Women's Health Institute. As a clinician, your first job is to learn to take care of your own needs. This is an embarrassing problem and really common. I mean, look at this. This is one of those Facebook memes, right? Jumping on a trampoline is one of the most fun ways to spend quality times with your kids while inadvertently peeing your pants. That should not be happening. We shouldn't need all these special pads and, we shouldn't be expecting to leak when we're exercising. And as I said, this is an embarrassing problem, and girls and women need to know who they can talk to about this without just hiding it. They're not going to bring it up on their own. They're just going to be wearing pads, or worse, avoiding doing these activities at all. And it can get worse. Prolapse. So prolapse is when one of the pelvic organs actually kind of falls down into or even through the vaginal opening. So if you see over here, cystocele, if you can see my little pointer, cystocele is when the bladder is falling through the vaginal opening here. You can also have the uterus fall straight through the vaginal opening, a uterine prolapse. And rectal prolapse can happen. The rectum can again fall through either kind of forward through the vaginal opening or even through the rectum. So prolapse is a risk that comes with impact, that comes with running too soon or impact too soon postpartum. It comes with increased intra-abdominal pressure. So when we have women who have had a baby, 6 to 10 weeks earlier, doing ab crunches and planks and jumping rope and lifting heavy weights, it's irresponsible to do that unless we talk to them about their pelvic health and they have strategies for supporting these organs of the pelvic floor. We need to keep women exercising, and it is our responsibility to minimize their injury risk. The goal isn't necessarily to stop the activity, although they may need to stop the activity short term, depending on symptoms and surgeries and having babies and all of that. The goal is actually to screen for these issues and then address them with a multidisciplinary team approach. So if you're not a pelvic health physical therapist or physiotherapist, what do you screen? You should just simply ask your clients, are they leaking urine or feces with activities like running, walking, jumping, weightlifting, coughing, sneezing, Pilates, abdominal exercises? Are they leaking at any time? That's a good, simple screening question. It's important. No one else has asked them that. Not their gynecologist when they had their baby, not their family doctor. We have data that shows that this is not something that most professionals bring up. And unless they're asked, women are not going to tell their healthcare professionals about this problem. Do they have a falling out feeling in their pelvic floor area? A lot of times women will have prolapse and they will have never actually even looked for it because we do have that black box around the pelvis and external genitals. Women really do kind of separate themselves from that body part very often. So they might feel like this falling out feeling, but they may not have even looked there. And does it worsen with activity, exercise, or sports? Do they feel like they need to wear a pad during practice, fitness classes, or just in case? Do they fluid restrict or urinate before practice or the fitness class or your personal training session? Again, just in case. And do they have pelvic pain, vulvar pain, cramps, vaginal pain? Are these worse with exercise, worse with their period, worse since giving birth, worse since menopause, worse over time? All of these are questions. If they answer yes to any of these questions, inside of our program, we'll show you how you can collaborate with each other, refer to one another, but you need to start building your network of other clinicians who do specialize in pelvic health. So here are some tools you can use right away. If you're not a pelvic health PT, who can help you if your client answers yes to any of these screening questions? Well, there are also some things you can do depending on your specialty. As a nutrition professional, you can recommend nutrition to better support the strength of the pelvic floor muscles and soft tissues. So just like we recommend collagen and vitamin C when we're talking about recovering from post-op knee surgery or strengthening muscles, building muscle strength, building joint strength, the exact same thing applies. It's just different anatomy. The pelvic floor has muscles, soft tissues, joints. If there's pain involved, we can recommend anti-inflammatory nutrition strategies, elimination diets, gut healing strategies, antioxidants. All of these work in the pelvic area just as they do in every other part of the body. Also recommending endocrine balancing support, things like reducing sugar to reduce cortisol, balancing estrogen and progesterone. And there are lots of strategies that you as a nutrition professional often know about how to use food as medicine for these systems, and it's no different in the pelvis. If you're not a pelvic health PT, but you are a sports coach or health coach, there are lots of things you can also work on. Again, you may be collaborating with each other. Does your client athlete feel valued as a person over her performance? Does she have mindfulness strategies for stress reduction? Stress is very important because when stress hormone levels get too high or become depleted, that actually depletes sex hormone levels, which can directly influence pelvic pain. So your work on stress can directly influence pain. Understanding the mood flow of her menstrual cycle. We'll talk more about that in video 2. Is she overtraining? Is she on the edge of burnout? The hormone levels, again, can impact pelvic pain. And what are her goals? Are they in alignment with the goals of her coaches, of her parents, of her team? Has anyone ever asked her for her vision? What does success in fitness, in her sport activity, what does success look like to her? If you're not a pelvic health PT, but you're an orthopedic PT, fitness professional, occupational therapist, yoga instructor, Pilates instructor, again, bringing awareness to pelvic strength, pelvic weakness, tightness, relaxation, motor control. Is your client even aware where her pelvic floor muscles are? You can be a brilliant educator. You don't have to be doing pelvic exams to be educating your clients and patients on where the pelvic floor muscles are, that they have some voluntary control over them, that leaking and pain are not normal. You have the ability to teach a lot of stuff that will greatly benefit your clients and help them to self-select. Some of them are going to have perfectly healthy pelvic floors and just continue on. The ones that don't, you can screen for and refer on. So one of the most important business building tips that I have experienced in the growth of my practice and in the growth of this institute is building a collaborative network. If you're a pelvic health physical therapist or physiotherapist, I really hope you'll recognize the value that other professionals bring to the table in helping women to be more aware of their pelvic health and that they have specific resources to support your work. If you're a coach, a health coach, a nutrition professional, fitness professional, otherwise physical therapist or occupational therapist, connecting with the pelvic health specialist in your community, talk with them about how your work with athletes can support their work. Cross referrals with a constant focus on the holistic mind, body, spirit needs of each individual patient. You're the ones who know your patients and clients best and what they need. Not everyone feels comfortable at first talking about pelvic health or seeking a pelvic PT, but you just start cracking open the door. And athletes, even pre-pregnancy, are at high risk for issues that can stop them from exercising, competing, and performing. If they're leaking, if they're in pain, they will just stop without necessarily seeking appropriate treatment. So, in summary, when you do this kind of education in your community, when you kind of open the curtain of that pelvic black box and you share with the athletes that you understand the risks, you understand the things that they're going through, and you have resources for them, you are sharing your wisdom in a way that will start to really grow your practice. And I hope that you enjoyed meeting Julie, Michelle, and myself. We are absolutely thrilled to share with you our perspective on how to holistically treat female athletes, beginning by not forgetting that they commonly have pelvic health concerns. So, screen for pelvic health concerns in the female athlete in your practice. Find new clients by teaching about pelvic health concerns and how you can help in your community at your local CrossFit gym. You know, how many of you have seen the video of CrossFitters lifting weights and literally peeing on video? You know, there's a great place to start the conversation. Mom and Me boot camp classes are 10-week postpartum moms doing planks. That's probably not appropriate, right? Tween gymnastics or ballet classes. Are they wearing pads already in middle school and high school competitions? Who has talked to these women and girls? Who has talked to their parents about incontinence, prolapse, and pelvic pain risk? Probably no one. They will be so grateful to have you as a resource. And then collaborate with each other. All of our courses give you access to our private student forum, which is global and growing literally every day. Inside that forum is the best place for you to start building your network and getting support with your most complex questions. All right, so I'll see you in video 2, where we're going to be talking about nutrition for female athletes, filling in the gaps for young female athletes. You know, is post-game pizza and Oreos, is that the best we can do? And how to shift nutrition recommendations with the menstrual cycle. This is your client's secret performance enhancer. All right. I look forward to seeing you then. Again, my name is Jessica Drummond with the Integrative Women's Health Institute, and I will see you in video 2. Bye.